So you're facing a pretty major decision about spinal surgery, and you're probably feeling completely overwhelmed. I get it. Okay, let's dive in and try to bring some real clarity to this. The goal here isn't to give you one single right answer, but to give you a framework, a way to find the right answer for you. And that quote, it just gets right to the heart of it, doesn't it? We're going to move away from this hunt for a universal best surgery. Instead, we're going to focus on making a defensible, personal choice that you can really stand by, no matter what happens. It's all about building a solid case for your own decision. Now, this is the big one. This is the question everyone asks first. It feels like the main event, the ultimate choice you have to make. But what if I told you this is exactly the wrong place to start? That's right. Asking fusion or decompression first is like trying to choose between a hammer and a saw before you even know if you're building a bookshelf or tearing down a wall. A much better starting point is to get crystal clear on the specific problem your body is actually asking you to solve. So our first major step is a huge mindset shift. Before we even start talking about the tools, the surgical procedures, we need to deeply understand our own spine-specific failure mode. What's really going on in there? Is it a space issue or is it a stability issue? Let's break this down into the simplest terms. Think of it this way. A decompression surgery is all about making room. The whole point is for the surgeon to get in there and remove whatever is crowding or pinching a nerve. That could be bone, a ligament, some disc material, whatever. A fusion, on the other hand, is about stabilizing. The goal there is to stop a part of your spine from moving in a painful or unsafe way. Now, sometimes you need both, but really understanding this core mechanical difference is absolutely crucial. This brings us to a really powerful test for yourself. Can you explain the goal of your potential surgery in plain English? I mean, it's not enough to just say, oh, I'm having a laminectomy. You should be able to say something like, the goal is to remove a piece of bone to create more space for the nerve that's causing all that pain down my leg. If you can't do that, you're not ready. You just don't have enough clarity yet. So, how do you get that clarity? Well, you have to become a detective of your own pain. Seriously. For 1 week, I want you to track your symptoms with almost forensic detail. Where does it start? Where does it go? What makes it flare up? What calms it down? This simple log turns a vague feeling like my back hurts into objective data. And that data becomes one of the most valuable things you can bring to your doctor. It helps everyone connect the dots.
Okay, next up is your imaging review. Your MRI, your x-rays. Don't just sit there and let the medical jargon wash over you. You've got to be an active participant. Use these questions. Ask your doctor, can you show me right on the screen where the nerve is crowded? Or do you see any evidence of instability? And the most important one, does this image actually match the symptoms I'm feeling? This is so key because imaging can be full of red herrings. Lots of people have stuff on an MRI that causes them zero pain. You need to find the spot on the image that matches the story your body is telling.
All right, once you've clearly defined the problem, it's time to get brutally practical. Now we can start to weigh the real-world trade-offs of each option. This is everything that happens after the surgery. Look, recovery isn't just this one big blob of time. It's a schedule, and it helps so much to think about it in these 3 phases. The first couple of weeks, that's survival mode. Then you move into this cautious return phase, and after that comes the real rehab. Thinking about it this way makes it all so much more tangible. And it's really important to know that a fusion recovery is often longer and way more structured than a simple decompression. Knowing this timeline helps you plan for everything: support, time off work, and your own sanity. When it comes to risks, getting a long, generic list is honestly more terrifying than it is helpful. Here's the game-changing question to ask your surgeon. For me, personally, what are the top 3 risks? Your age, your bone density, your overall health, all of that can shift the odds dramatically. This question turns a scary, abstract conversation into a really practical discussion about what you can do to prevent and manage those specific risks. So here's a way to kind of map out the clinical logic. This is not a simple flowchart where you just check a box, but it shows you the thinking. If your story is all about that sharp nerve pain shooting down your leg and your scans show no major instability, well, the conversation might lean more toward decompression. But if your pain is more mechanical, it gets triggered by movement, and there's clear evidence of a vertebra slipping, that's when fusion really enters the discussion. This helps you understand the long game of each choice. All right, now let's talk about everything that happens outside the operating room.
This is the logistical and mental prep that can honestly make or break your whole experience.
Before you even get a price quote, you have to establish eligibility. Insurance companies think in checklists, and this is pretty much it. Have you documented that you tried other things first? Does the diagnosis actually match the problem? Have you proven this thing is wrecking your daily life? Getting a yes to these questions is your first and, frankly, most important step.
Please do not see these pre-surgery steps as just a delay. Think of them as building a stronger case. Every single documented attempt at conservative care strengthens your insurance file, it makes your final decision more solid, and it dramatically reduces the risk of you looking back with regret. And asking for a stop rule, a clear sign that conservative care has done all it can, that is a powerful way to know when it's really time to move forward.
And this brings us to what might be the most important mental shift of this entire process. Your goal is not a magical 100% pain-free guarantee. That's not realistic. Your goal is to make a decision that is so well-reasoned, so thoroughly researched for your specific case that you can look back in a year and know with confidence that you made the best possible choice with the information you had. That is how you protect yourself against regret. Okay, so let's pull this all together. Let's crystallize this entire process into a simple map that you can actually take with you. Think of this as your guardrail to protect you from making a choice based only on fear or wishful thinking. Here it is. Step 1. Name the driver. Is this a space problem or a stability problem? Step 2. Match the evidence. Does your imaging confirm what your symptoms are screaming at you? And finally, step 3. Pick the path that feels the least regrettable, the one that directly tackles that driver and actually fits with the realities of your life and what you can handle for recovery. Knowledge is completely useless without action. So right now, in the next 15 minutes, you can take these concrete steps. Don't just watch this, use it. Go on, open a document and create that log. List out your goals, draft that email. Let's turn this passive learning into active progress on your own case. And that's the final takeaway. This whole process is daunting, I know, but you are not powerless. By replacing that free-floating anxiety with a structured, methodical approach, you take back control. You become the pilot of your own healthcare journey, fully equipped to make a clear, confident, and defensible decision for yourself.